Hello, good evening, and welcome to episode 2 of our new live series, The Definite Article. Thanks for joining us on this Monday evening. I'm Emily Carver, and this evening I'll be joined by the IEA's Senior Academic Fellow, Professor Philip Booth, who is also Dean of the Faculty of Education, Humanities and Social Sciences at St Mary's University, Twickenham. The show will be live every Monday on our YouTube channel. It's your chance to hear live from our experts on their latest articles that they've written for national and international newspapers, news websites, magazines, and you get to put your questions straight to them. Before we kick things off, make sure to click the subscribe button and the notification bell to make sure you don't miss any of our new videos. We've got new video content every day of the week at the moment, so don't hesitate to ask questions. I will try and pick up on as many as I can. So this evening, I'm joined by Philip Booth. We'll discuss his latest article in the Telegraph. So Philip, thanks for joining me this evening.
Thank you.
So on the agenda tonight, we have your latest central planning has failed miserably in this pandemic. For those who haven't yet, it would be great if you could start by briefly explaining your main argument.
Okay. You froze once or twice in that introduction, but so hopefully I'm doing what you asked me to do. But basically, I decided to write the argument when I sort of was getting the impression from listening to some of the debates that were going on around coronavirus, that we were having a similar debate as to those that we had at the end of the Second World War, which led Friedrich Hayek to write The Road to Serfdom. And in there, he argued, amongst other things, that if a country had an existential threat to which it had to respond, then central planning might be the right thing to do, because you had to mobilize all of the resources of the country towards one particular end, and you might have to do that in a particular way as well. And he made the point, and actually there's some quite interesting footage on the television program The World at War of people like Michael Foot articulating the view that if that is the right way to win a war, and if it was so successful in winning a war, then surely that's how we should behave in peacetime as well. If we can centrally plan the economy to win a war, surely we can centrally plan the economy to maximize welfare in peacetime. And instead, Hayek argued, that of course, in peacetime, the different people in society have a whole range of different objectives and a whole range of different ways in which they wish to meet those objectives. That information can't be centrally controlled. It can't be known by a central planning authority, and therefore central planning would fail in peacetime. Of course, we saw that happen with the communist countries and to a limited extent, our own country, the UK, which took the central planning route. And I saw similar arguments happening during the Covid-19 outbreak, at the beginning at least. People were saying, capitalism has failed here. Capitalism is fine, but when there's a big threat like a virus, it doesn't work. We need the government to intervene. Because the government is intervening in relation to COVID-19, it just shows how important the government is. And when we should learn the lesson from this, that when we come out of the other end, that we should have much greater involvement of the government in the economy in normal times. And I mean, one particular manifestation of that was that when the government decided to pay lots of money to people who were being furloughed or in other unfortunate situations because of the virus, people said, oh, it'd be great to translate this into peacetime, and let's have a universal basic income where the government gives everybody money in peacetime too. So this sort of translation of ideas and approaches which might seem okay in wartime or when a country faces an existential threat, to then argue that we should take the same approach in peacetime is just a fallacy, and an incredibly dangerous fallacy. And of course, it led to the economic destruction of large parts of Central and Eastern Europe after the Second World War.
Yeah, I mean, I don't know if you watched the Prime Minister this morning outside Number 10. Did you watch it?
I'm afraid I didn't, but I did read his key points.
Yeah, he gave in his first speech since his recovery, he used the national collective memory of the Second World War, as a rallying point. He explicitly described the battle with the killer virus as, quote, the biggest single challenge this country has faced since the war. You also make the comparison with wartime in your article. could you explain a little more what exactly the fallacy is in the argument about planning in wartime and planning and translating that to peacetime?
Okay. Yeah, so in wartime, and in the case of this virus, we have one overwhelming objective. So in wartime, it's to defeat the enemy and to stop invasion, perhaps, probably. In the case of this virus, it's to stop the transmission of this virus. And we are willing to use all the economic resources available towards that one particular objective. In normal times, of course, there are 60 million people in the country, all of whom have different objectives. Some people might want a career in a particular field, might want to open a business in some area. People might want to orientate their consumption in one particular pattern, or other people will have preferences for different goods. And whilst it might be possible for a central planning authority to define one overriding objective during wartime and try to mobilize the economy to achieve that particular objective, it's not possible for a central planning authority to accumulate all the information, most of which is tacit, most of which is held in our own minds, most of which is very subjective, about what we all want to achieve in the economy, and thereby centrally plan the economy to achieve all those different objectives that we've got. So it's just a fallacy that if planning in wartime is a good idea, planning in peacetime is a good idea too. I should say that, in fact, both this experience, and this may be something you want to explore further, both this experience and wartime does not overwhelmingly suggest that planning in wartime actually is even a good idea. So if planning doesn't work in wartime, it's certainly not going to work in normal times.
Yeah, we have a question from our YouTube audience. What does Philip think the differences might be in beating a virus compared to beating the Nazis? Doesn't the latter lead to celebration, whereas the former just to a sense of relief? What are your thoughts on that?
Well, that might well be true. It's difficult to know how exactly people felt after 1945, and it probably was a sense of relief, and a fairly short-lived sense of relief, because we then got back to normal everyday life and the economy had been crippled. Not only that, because we tried to adopt central planning in peacetime, the British economy was very slow to recover, and we had 6 years of austerity and with some very severe winters, and at the same time having to suffer rationing, whereas in other continental countries they got by much better. There are a lot of analogies actually with the virus. You know, we've mobilized a lot of our economic resources to try to defeat the virus. The one big difference, I suppose, is that in wartime we took huge amounts of resources from the private sector, effectively made them unemployed, and then used them to try to win the war. In the case of the virus, we're trying to defeat the virus by simply stopping people's economic activity. It's not as if we're taking 5 million people out of the workforce and using them in the NHS. We're simply telling 5 million people they can't go to work anymore. And actually that does bring a different set of problems, because if people are not working for a long period of time, their skills start to deteriorate, and actually recovery might be more difficult even than it was after the Second World War.
Psychologically, how difficult do you think that it's going to be for people to get back to work? Do you think there's going to be an inertia? People are going to sort of have got used to sitting at home and still getting paid 80%. How long do you think that that's going to take? How long do you think it's going to take for us to get back to normal?
I don't think it will take that long to get back to normal. The government will soon have to stop paying 80%, otherwise the government will be accumulating debt at such a ridiculous rate it won't be able to go on any longer. The real danger here is that businesses go bust, and once a business goes bust, it's then very difficult to recreate it. So that's one of the reasons why the government is intervening in such a way that it's trying to keep businesses going, so that when we come out of this lockdown period, we can try to pick up where we left off. But working in a university, you see the problems there. So if our university is shut down until August, we can cope with that. In September, we'll be able to pick up again where we left off. If we're still shut in September and October, that introduces a whole different ballgame in relation to how we manage the university, whether or not we have any students, whether or not we're able to afford to keep on any staff. And it doesn't follow that we could pick up in January or February where we left off this month, but we could pick up in September, or pick up back in September where we left off this month. And it's the same for restaurants. If a restaurant is able to just about keep its cash flow going and not go bust, it can probably start again in June or July without any great problems. But if it goes bust, it's probably gone bust forever. It's not going to come back again. And of course, the employees have lost their jobs forever. So the longer this lockdown goes on, the more irreversible the economic damage will be.
And I wonder if consumer habits will change. I mean, people have been going without their daily Costa coffee. People have been going without hitting the pub every evening after work, all sorts. Do you think that there might be, do you think that we'll suddenly have a shock, like a rise, go back to normal, business as usual, people are going back to spending as they were before? Or do you think that there will be a lull there as people sort of realize they don't need to be spending quite so much?
I think there will be a change in patterns because people have been forced to change their behavior, and some of the working patterns have been forced to adopt. They might well prefer to those that they actually used to have before. And the same goes for consumption patterns as well. Now, if I thought I could predict this, I would be a central planner. I wouldn't have made my earlier statement that central planning is okay, might be okay in wartime, but not in peacetime. But what I think we can say with certainty is that things won't be quite the same. I suspect people will be a bit more reluctant to go on foreign holidays. Certainly for a few years, they'll be a bit more reluctant to take decisions which involve committing themselves to doing particular things at particular times in the future because they know that this could come back. Perhaps people will get used to consuming a bit less and saving a bit more. No great harm from that, given the incredibly low savings ratio of the UK. Perhaps there'll be a house price crash, and if there's a house price crash, all sorts of good things could come from that, as well as a few problematic ones, but generally good. So yeah, things will change. The economy will cope with most of those because a free economy is able to cope with those things and is able to cope with change, unless we're locked down for so long that we have a huge number of bankruptcies and capital and businesses are essentially destroyed.
Yeah, I mean, the communitarian left, and it's something that you raise in your article, have talked about volunteering and the community response and said how this shows that we could reshape society in the future away from nasty capitalism, I suppose. What do you think the response to this should be by those of us who believe in a free society?
Okay. Well, those of us who believe in a free society don't believe, of course, in nasty capitalism. We believe in nice capitalism. And the problem of the communitarian left is that they tend to conflate the community, society, and the state. And perhaps one of the more sensible things that David Cameron ever said was the Conservative Party does believe in society, it's just not the same thing as the state. And I think what this crisis has shown is how responsible people are, how community-minded people are, and also how, if you like, grown up they are. And I'll come on to that question in a second. But in relation to the first two, we already had 20 million volunteers a year before the COVID virus hit us. We then have an overwhelming number of volunteers wanting to volunteer for the NHS. So many, in fact, that the NHS had to stop asking people to volunteer. And there are large numbers of charities which actually can't cope with the number of volunteers that they have now. And no, that's marvelous. I think it just shows how responsible people are, and it shows how much they care about each other. And they don't need the state to intermediate those relationships. Civil society and the community are and should be distinct from the state and should enrich a free society. And this is, I think Archbishop Welby in particular regularly makes this mistake, sort of conflating community action with the need for a greater role of for the state.
Yeah, we see. Sorry, go on.
I think what we've also seen is that people have been acted incredibly responsibly. For the last 30 years, we've had this huge increase in bureaucracy, overwhelming everything we do in the public sector and in the private sector. Now, anybody who works in a university or for a business knows how much HR decisions and policy documents and other things actually come to sort of rule the organization rather than people's own wisdom and judgment and people taking responsibility. I hope that perhaps after this event, one of the things that will change is that, first of all, people just realize that people can take responsibility and can be grown up. And secondly, actually, that we can't afford all this bureaucracy anymore. That the economy will have great problems. There'll be high levels of unemployment. The government debt position will be dreadful. There'll be very high levels of government spending. The one thing we can do to lighten the burden is to strip away large volumes of bureaucracy and regulation and let the people rise to the challenge.
Yeah, I mean, if we've got another question from our YouTube audience, if the Prime Minister asked for economic policies post COVID-19, what would some of your suggestions be? So you talk about regulation first.
Yeah, my first suggestion would be to strip away large amounts of labour market regulation. Secondly, I suppose this is a category of labour market regulation, I would put a hold, I'd like to see it abolished, but I would put a hold on the so-called national living wage and start once again taking the recommendations of the Low Pay Commission about the setting of the minimum wage, because if people's skills have deteriorated, we could have quite high levels of unemployment persisting for a long time if the state is artificially raising wages. I would, and this is of course not something that has been, this is something which has been a sort of IEA theme for a long time, liberalise land use planning. Again, one thing we can do is ensure that housing is much cheaper for people. And something else I would do, and again, it's been a theme of IEA authors for a long time, is look very carefully at the way we index pensions. It is absurd that pensions are indexed to the higher of 2.5% inflation and wage inflation. And that's could be a huge cost to the government if wage inflation goes negative, which it could well do, and if price inflation goes rapidly towards zero. So I would certainly remove the triple lock and just simply index pensions to inflation for the foreseeable future.
Will W.
I should add,
sorry, go on.
Yeah, I would also add, learn the lessons as well that about central planning having failed in wartime, if you like, and look at more decentralized models of providing healthcare. It seems that the Germans have done much better than we have, and our central planning of things like PPE, testing, the building of the now empty Nightingale hospitals have not been as effective as all the as the approaches taken in Germany, where different Länder look after things in different ways, and you have a heavily decentralized health system which relies on a myriad of suppliers and insurers.
We've got a question from Will W on YouTube. He says, were you disappointed, Philip, by the sounds coming from the Prime Minister today with regard to the ongoing lockdown?
Well, as I said, I didn't hear exactly what the Prime Minister said, but I think he said...
Oh, sorry.
Yeah, no, go on. Okay.
He said that we should be patient.
He said we should be patient, and he also said, this is the moment of highest risk. Now, given how, as I said before, people are behaving in a grown-up way, I think you have to talk to people as if they're grown-ups, and telling people that they are that we are now entering the moment of highest risk is simply not true, and we shouldn't be telling people that. Currently, we are at a much lower state of risk than we were a couple of months ago, because apart from anything else, we know how deadly this virus is. It's killed over 20,000 people. We are going to adjust as individuals our behavior, even if some of the restraints come off. So this is not the moment of highest risk. What would I do now? Well, a couple of weeks ago, I would have, on a regional basis, experimented with different approaches to removing the lockdown. Perhaps in one region allowed a certain number of people to go back to school, in another region allowed small shops to open, in another region to allow garden centres to open. So we could actually have a bit more information on what works and what doesn't. But unfortunately, we've now sort of missed that point, and I think we have to start nationwide liberalising the lockdown to some degree. Otherwise, people are not going to carry on behaving in the restrained way they have been behaving.
Yeah, we have another question here from Matt Carter. He says, "Hi, Philip. If you had been in Rishi Sunak's shoes, would you have designed the various business relief packages differently? If so, how? Cheers." Okay,
I'm not a great expert on those things. Julian Jessup, I think, at the IEA knows more about the precise details of that, of those schemes than I do. I think the furlough scheme is quite well designed, but it does worry me that it leaves people with very little incentive to do alternative work. So for an employer, laying people off is an easy alternative to perhaps paying them less and then getting their people's wages topped up, but keeping them busy doing something. And for an employee, especially if you're a low-paid employee, being furloughed is a pretty good alternative to having to go to work all the time. So I'm a bit worried that the furlough scheme has essentially stripped out incentives to work, when clearly there are important jobs that need doing. In relation to businesses, I'm slightly worried by an approach which only gives businesses loans rather than grants, which I think is the main approach so far. But I'd say I'm not an expert, because no, the government has come in here and effectively banned people from trading, and I think the taxpayer does have a wider responsibility to those businesses than one that simply gives them loans, which still might lead them to go under, because if their equity capital is wiped out, they'll go bust in any case, and that will have serious economic consequences after the lockdown. But say I'm sort of, won't say I'm out of my depth, but I don't know enough about the detail of the schemes to comment further than that.
I mean, this is all unprecedented, really. So it will be a while before we know the ramifications and the consequences of all these policies. We've got lots more questions, actually.
Okay.
We've got one that's asking you: will we need a massive dose of austerity to pay off the debt accumulated, or have classical liberals lost the fiscal argument, and will we have to live with high taxes? Now, this was the topic of a video that we did the other week, which is also on our YouTube channel, so check that out. Yes, so would you like to answer that?
Yeah, okay. So there's no contradiction necessarily between austerity and high taxes. It depends how we define austerity. But so what will happen at the end of this period is that government debt will balloon to, we don't know what, 120, 130, 140% of national income. If you add that on to the problems of an aging population, and you look at the OBR's Office for Budget Responsibilities fiscal sustainability report, that the long-term situation for the UK debt looks absolutely dire. Now, some people would say, don't worry, interest rates are going to remain around zero. We can inflate our way out of this. We've borrowed in our own currency, and you could always just print more money in order to repay the debts. And it all went well after the Second World War, and it all went well after the Napoleonic Wars. But after the Napoleonic Wars, we had a very large fiscal surplus for very many years. And after the Second World War, we had really very high levels of inflation. The pound lost 98% of its value in just 50 years. And the problems that caused in the 1970s were enormous. Of course, they led to the election of Margaret Thatcher. So we should not assume that this is a straightforward problem. So we will have a huge debt pile, and we'll have to deal with that some way. I actually think that, we'll have to take radical measures to try to raise productivity. The most obvious one for that will be to liberalize house building, liberalize property building more generally. I think we'll have to take radical measures to restrict welfare spending, especially welfare spending on older people who more or less escaped the last version of so-called austerity, in which public spending actually stayed more or less constant, even in real terms. And we'll have to do all those things. I'm afraid I think we will have to raise taxes too. I don't think there is any other way of repaying this debt unless you do, or even indeed managing the debt, unless, at least for a period of time, you do have higher taxes. And it's sometimes tempting for classical liberals to say, we want to avoid raising taxes at all costs. Well, if that cost is simply imposing a burden on the next generation, then that's perhaps not an appropriate cost, and the current generation will have to endure high levels of taxation. The question, I suppose, is classical liberals would prefer to see all this done on the spending side. They'd like to see much more responsibility for people in terms of financing healthcare and education, other forms of welfare and spending and pensions. I'd like to see much more responsibility in being given to the individual there, which would allow both spending and taxes to be lowered. I would certainly support that. But if the electorate is not willing to accept lower spending, I would prefer higher taxes than a crippling level of debt for the next 2 generations.
We have another question. Are democracies, this is from Caetana Numa, are democracies better at central planning during a war or a pandemic compared to non-democratic countries?
Okay. Katana is from Lithuania, by the way. Might add, just embarrass her slightly. She's PhD student of mine as well. At Kingston.
Oh, really? Oh, hello.
And John Meadowcroft, if he's listening. I think the evidence of the Second World War. I'm not a historian or an expert on this, but it has to be said that democracies seem to be rather better in the Second World War than non-democracies. But, and I think this is an even more interesting question, which relates also to the pandemic and the comparison between the German and the UK health systems. Those that centrally planned the least seem to do better in the Second World War than those that centrally planned the most. So I suppose this might be naivety on my part, but I think if you were to order the countries in terms of how much central planning they used in the war effort, it would probably go the Soviet Union, Nazi Germany, the UK, the US. And unquestionably, the efficiency in wartime was exactly in the other order. The US was the most efficient, then the UK, followed by Nazi Germany, followed by the USSR, which, although it ended up on the right side, lost 17 million people in the process. Now, historically, of course, Britain has never lost a meaningful war, and Britain, I suppose, is the oldest democracy, maybe other than Switzerland, I don't know, which also hasn't lost a meaningful war for a long period of time. So I suppose you could say that the record of democracies there is pretty good, but anybody who studied the Napoleonic Wars would say that Britain was pretty lucky at the Battle of Waterloo, and it wasn't necessarily our democracy that won the day there, but the timely arrival of the Prussians.
Yes, I think you'd have to make lots of comparisons there to draw some conclusions.
Yeah, I think you would, yeah.
Another question from Christopher Haley. He asks, some states have stepped into direct firms to produce more ventilators. Does that not reveal the limited ability of markets to react quickly enough in a crisis?
Yeah, I think this is, it's a particular type of crisis. And as I said right at the beginning, you can justify in such crises central planning. Now, the answer to my last question, I think, demonstrates that how much central planning you have is a matter for debate. But there's no doubt that if you're going to have some kind of a lockdown, that has to be centrally planned. If the health service needs really, really quickly on an unprecedented scale, huge numbers of ventilators, that also has to be, to some degree, centrally planned. But it has to be said that there is, whilst the evidence will have to be weighed up, so maybe it's going too far to say that Germany has done much better than the UK because of its decentralized system. You can make the negative of that statement, that it's certainly not clear that the highly centralized approach that the UK has taken to PPE, to testing, to the provision of ventilators, and to the building of the Nightingale hospitals has been more successful than the more decentralized approach of countries like Germany. The onus, I think, is on those who support centralized central planning to demonstrate that the NHS has actually done better than Germany because of central planning in this pandemic.
Would you be able to say whether there is any element of central planning that has worked during this crisis? Or is it you can't really?
Yeah, okay, the lockdown couldn't have worked without central planning.
Sure.
The deprioritization of people turning up at doctors and with other ailments that needed treating and so on in the health service, that couldn't have worked without some degree of central planning. If you had an entirely private health system, I should imagine, that was totally profit driven, and without the health providers wanting to make any adaptation to be compassionate in a crisis, I should imagine hospitals would have carried on treating cancer patients and not bothered so much about COVID-19 patients. But instead, as a result of government's edict, the health service has reordered its priorities. But the health service has also a more decentralized systems, but there's also always an element of central planning in any system. But having said that, it does seem that we've gone too far. There are GPs saying they've never known it be quieter in a GP surgery. There are our hospitals are working below capacity. The Nightingale centres, I think all of them are empty. You could argue that the risks of not going far enough in terms of postponing other health treatments and so on were very grave, and therefore it was a good idea to do what the government has done. But it does seem that we've gone too far, and that will cost lives in the future. People are having cancer treatments and so on delayed because of the need to keep capacity in the system. A system, I should add, that has very, very little spare capacity by design, whereas again, more decentralized systems, because you have different hospitals competing against each other, tend to have more capacity, spare capacity in them.
Now, before we finish, I'm just going to see if anyone else has any more questions. If you do, quickly type them in the chat box and I'll put them to Philip. Otherwise, I think we have one more question waiting, which is, central planning in peacetime is a worry, but isn't there a similar or greater threat that government will seek to intrude further on our civil liberties?
Well, I think there's clearly a threat, and there always is a threat. But I do just wonder whether or not, as a result of this episode, there is an opportunity to tap in, I think, to what is an overwhelming feeling that people have in general behaved responsibly, and we do that without being directed by legislation. I think that's happened in the social sphere, but it's also happening in the work sphere. So in my university, we had 2 days to plan a movement to go from face-to-face teaching to online. Now, not all universities, I don't think, have necessarily done it all that well, but at St. Mary's, we've been extremely successful. And there was no central direction at all. We were given 2 days and told to do the best we could, and everybody did very well. I think, as I said before, I'm not sure I think we'll come to the conclusion that if we're going to jettison any luxuries, then it may be the luxury of bureaucratic regulation that we jettison, as well as also coming to the conclusion that perhaps people are a lot more trustworthy and rise to the occasion to a greater extent than our lords and masters would like to think. And that might be a good outcome from this crisis.
That would be. On that note, I think we will finish up there. Thank you for joining us, Philip, our second episode. Thank you for our second episode of the Definite Article. That was Professor Philip Booth, Senior Academic Fellow at the IEA and Dean of the Faculty of Education, Humanities and Social Sciences at St. Mary's University in Twickenham. If you enjoyed the show, don't forget to like and subscribe for more content and for next week's live stream. Also, you can read Philip's article at the Telegraph website or on the IEA website. Just follow the link below. And thanks for tuning in, and see you next week.
Thank you.
Thank you.
Is that okay?